So welcome back, breast friends, to the fourth and final week with myself, clinical esthetician Jacqueline Sweet, and clinical esthetician Emma Claire.
Hi. Awesome. Well, welcome back to week 4, our final week. Today we have the pleasure of having our special guest, Dr. Maurice Nahabedian, with us in the house. Dr. Nahabedian, can you explain a little bit or an introduction of yourself and how you got into plastic surgery?
Sure. But first of all, thanks for having me. I think this is a lot of fun. Anyway, my name's Maurice Nahabedian. I'm a plastic surgeon. I've been a plastic surgeon for about 25 years in practice. Really became interested in plastic surgery during my general surgery residency, and I realized at that time that I was more adept at helping put people back together rather than kind of disassembling. I was always interested in oncology, and the whole reconstructive oncology aspect really was appealing to me. So that's when I made the decision to transition from surgical oncology to plastic surgery. I've never looked back. It was the best decision I've ever made.
Wow. How long have you been in practice for?
I've been in practice now for almost 26 years. Most of the practice has been in academic institutions. I was at Johns Hopkins for 13 years and Georgetown for 12 years. And I joined the National Center for Plastic Surgery a few years ago, so another really good decision.
And you haven't looked back since, right?
Haven't looked back.
Awesome.
Life is good.
Oh, good. Well, Jackie, I think you're going to start with our first question that
Sure.
got submitted.
So I think we kind of just answered that. It was going to be what inspired you to become a plastic surgeon?
Yeah, again, I think it's just being able to help people get back to normal rather than making them super normal. I just always had an interest in oncology, and to this day, that still is my primary focus. So I apply all the oncologic principles and really transition that in towards reconstructive surgery to really transition patients and help them get through very difficult times.
Awesome. Can you share one of your most fulfilling medical experiences, like in the OR or even here in the office, that you've seen with a patient?
There have been so many memorable experiences. It's hard to pick just one. I've probably taken care of 3,000 or 4,000 breast cancer patients, and really each one of them is a unique story, and each one of them has something that they've taught me or I've been able to help them with. So probably the most memorable experiences for me really occur on a day-to-day basis when somebody really demonstrates their gratitude and appreciation for what we've been able to do. So I think that's what keeps me going day after day and year after year. It's just the appreciation and the thanks that people have towards what we do.
Yeah. And I'm in the room quite often with this man, Jackie. Alongside doing clinical aesthetics, I also do a little bit of MA work, medical assisting work with Dr. Nahabedian, and your patients are always fawning over you and saying you're singing your praises. So
yeah,
we have a lot of happy patients.
Yes.
Yeah, I no doubt have the best job in the world.
Yeah,
so.
Awesome. So as a medical pioneer in this specialty, what advice would you provide to someone at early stages of the diagnosis?
It's a very good question and an important question, because at an early stage, I mean, there's a lot of anxiety, there's a lot of fear. Patients don't really know what the right decisions are or what to do because there are so many options now. But the best advice I could give somebody is try not to be overly anxious. There's no wrong decision. There are so many different things that we can do when it comes to reconstruction, and we can make it work. Breast cancer has gone from being a very deadly disease 100 years ago to now being very curable. With early diagnosis, the likelihood of you doing well is so high. And I really try to emphasize that with the patients. And sometimes with reconstruction, we can make patients as good or even better than they were preoperatively. Yeah. So there is definitely a silver lining. So I really try to put patients at ease and have them relax, just to reassure them that we can really get a good outcome and restore their life to where they used to
and
be.
At the end of the day, it is their decision. And
absolutely, absolutely. We can kind of guide them and help them to make these decisions, but you're right, at the end of the day, it's their decision.
Yeah, absolutely. So say an initial reconstruction patient comes in, one of our new patients comes into the office. What questions should patients ask when they're considering reconstruction surgery?
Well, There are a lot of questions that can be asked, but I think probably one of the most important questions for a patient to ask their surgeon is, what would you do if I was your sister? And I think that really puts it all into perspective, because some surgeons are really good at some things and not so good at other things, so they always tend to steer them towards one direction. But I think if you're really good at everything when it comes to reconstruction, and somebody asks, what would you do if I was your sister, then you really have to kind of dissociate yourself from what your biases are and really focus on what's best for that patient. And maybe it's an implant, maybe it's a flap, maybe it's oncoplasty, but I think then you really focus on the patient.
So how do you work through the decision process when a patient wants revision after surgery?
Well, I first ask patients, are they happy with the outcome, and if there's anything they'd like to change. And if patients tell me that they are happy with the outcome, then I usually say, then we're good, and I like to see you back once a year just to see how things change. But if there's something that bothers them, then I will make an assessment as to whether I think I can improve what bothers them. And if it's something that I can improve upon, then I'll say, well, here's what we can do. Maybe it's going to be contouring the skin a little bit, or doing a little fat grafting, something of those sorts, or maybe changing the size of an implant or the position of an implant. So we can do a lot of different things when it comes to revisions, but I really want to just make sure that the patient's happy. If she's content with what she's got, then we're finished, and we don't have to do anything else.
Yeah, that's the most important part.
That's what we say to our patients all the time.
Yeah.
You have to look at yourself every day.
Right.
Yeah. If you're not happy with something, then
Yeah.
we can revise it and fix it with the skin. But if you're good to go, then we just go to kind of monthly maintenance with light peels or something like that.
Yeah.
Right.
Yeah. Okay. Well, how we've touched on this bits and pieces so far, kind of sprinkled through this conversation. But how should a patient select their plastic surgeon that's right for them?
Well, the first thing is always board certification. So patients need to make sure that their surgeons are certified by the American Board of Plastic Surgery. I think that's going to be the most critical thing. Other things that go into the decision as to how to select your surgeon, you got to get a good feel for the surgeon. You have to connect with the surgeon. You have to have trust and confidence in their surgeon. You need to make sure that your surgeon has experience in doing these things, and don't hesitate to ask them, how many of these have you done? What your success rates have been. And I think that carries a lot. And I think that talking to other patients that have been operated on by that surgeon can help as well, because it can be very difficult, because a patient comes in to see me, they don't really know me, they're meeting me for the first time, they may be seeing other people. It gets very difficult to make a decision, but a lot of it is just trust your gut feeling, and if you have a connection with that surgeon, then that's probably going to be the best thing. But also make sure that that surgeon can live up to what they say they can. So make sure they've got the experience and the ability to make sure that they get good outcomes.
Probably ask for like before and after photos when they come in the office, see kind of what they're looking at when
Absolutely.
they're finished.
And like you said, your gut will tell you. You'll know if you
Right.
connect with that person.
Right.
Because
Good
it's going to be I always tell our patients that we're going to be friends for a while.
Exactly.
So you need to make sure you feel comfortable with that. It's not one and done.
Right.
Well, years of a relationship.
And there's some patients that I've been seeing for over 20 years where I've done reconstruction, and they come back year after year, which is always really, heartwarming for me, because one, I get to see them.
I think they just want to see you.
Yeah.
So anyway.
So we're up to our last and final question. What medical advances do you foresee, or would you most be excited about in this specialty?
Well, the beauty of plastic surgery is it's full of innovation and advancements. There's a lot of smart people in our specialty, and they're always thinking of new ways or techniques of doing things. So it's interesting, because what I do today is not what I learned when I was in training. It's completely different. We do all these perforator flaps where we save the muscle, and we're using all these advanced techniques for prosthetic reconstruction, and now we do oncoplasty. I think the future, who knows, with fat regeneration, maybe
Stem
one
cells.
day, maybe one day we'll be able to take a small amount of cells and actually grow tissue. so that
That'd be crazy.
using your own tissues almost universally for breast reconstruction would really be ideal. So these are things that seem far-fetched right now, but
Yeah.
I'll tell you, in the next 5, 10, 15 years, who knows what's possible.
Well, you've seen a lot, so I'm sure to you
Yep.
it seems possible.
Absolutely. We've come so far already, and we're still advancing. So that's the beauty of plastic surgery. It's innovation and advancements.
Well, I have one final fun question for you.
All right.
To leave it on a high note. What is your favorite surgery in general to perform in plastic surgery? It doesn't have to be oncology. What is your favorite surgery to perform?
Probably no question. I think doing a deep flap breast reconstruction is probably my favorite. I mean, I've done probably close to 2,500 of these over the years.
Wow.
I started doing them in 1999, and it's something that we do almost on a daily basis now, especially within the practice, because between Dr. Misbahdi, Venturi, and myself, we're doing 250, 300 of these a year now. So it's something that we all really enjoy, and it's what really is the foundation for our practice.
And I remember kind of jumping on that. I remember you saying a few days ago or something like that, where there's only about 700 doctors or something that are considered microvascular surgeons or certified in the US. Is that correct?
Yeah, there's probably about 7,000 active plastic surgeons in the country, and probably about 10% of them do microvascular.
Yeah.
And that number has really increased over the past 10 years
Wow.
as the popularity of this operation has increased. But I would make sure that patients are aware that they need to really look into this. Because there are a lot of plastic surgeons who do very few of these, but make it sound like they do a lot. I mean, this is something that we do day in and day out.
Yeah, we do.
Do your homework.
Do your homework,
Do your
yes.
homework, no doubt.
Very important.
All right.
Well, thank you so much
Yes,
for
thank
joining
you.
us. They're
It's
going to
been a
love it.
pleasure.
So.
All right.
All right,
Thanks, guys.
thank you guys so much for watching Week 4 of Breast Friends. Thank you for joining us at the National Center for Plastic Surgery during Breast Cancer Awareness Month. I know Jackie and I have really enjoyed it, and
Yes.
thank you again, Dr. Nahabedian, for joining us today.
Thanks.
All right, see you later, guys.
Bye-bye.
Before we go, we just wanted to say thank you for tuning in every Wednesday for Wellness
Yes.
Wednesday. We've had so much fun, and we wish you all the best. But before we let you go, we want to let you know the specials. We are offering our dermaplaning facial, which is ideal for all skin types. We customize it, normally $170, and for Breast Friends, we are going to give it to you for $100.
Awesome. And if you're wanting to come in for any type of other general services or products, we are going to be giving Breast Friends 10% off all of our products and 15% off all of our other services if you are interested. But please make sure that you do a consultation first with Jackie or myself to avail of these offers.
Which is complimentary, by the way.
Which is complimentary, yes.
And we are offering virtual visits as well. So just call into our office, which Emma will let you know the phone number.
Link is right here.
And also our emails will be attached too if you have any questions. Again, thank you, and we look forward to hearing from you.
Thanks, guys. Have a good day.
Bye.